So I want to introduce myself. I'm Rachel Wall, owner and founder of Inspired Hygiene, and I'm super excited that you all are with us this evening. I want to also introduce Connie Simmons. I'm super excited that Connie is joining us. Connie is a coach with Inspired Hygiene. She is an active registered dental hygienist and has extensive experience in the topics that we're going to discuss tonight, specifically assisted hygiene. And she's going to share some of her insight with us tonight. Connie, also, you should know, is an educator. She's a published author. You have probably seen her articles in RDH Magazine. She's also been a featured author in the Practice Booster newsletter. She's very active with regards to just keeping up her knowledge with insurance coding as well as clinical development. So just super excited to have her on our team and to have her with us tonight. And then kind of manning the phones, we'll say, is Jennifer Stedman, our director of operations. She's going to be keeping an eye on the chat for us. And so if you have some questions, you can either raise your hand and Jennifer can unmute you and you can ask it live, or you can just type your question in the chat and she will just kind of interrupt us from time to time when it's appropriate to answer some of those questions. And then certainly we can take some input. And here's the thing, we have some answers. We don't have all the answers. We've not seen every single hygiene scheduling model. We've seen a lot because we have the privilege and honor of being able to work with so many practices across the US. So we've seen a lot of things done. We've seen what works well. We've seen some pitfalls. We've seen, teams work out of some situations, and we've seen teams work in a lot of different levels within these different models, and that is totally okay. I want you guys to just know that you can embrace these things wherever you are and make sure that it fits your practice. Just a brief agenda for this evening is to, just know that you have the power to take control of your hygiene schedule. When to consider an alternative scheduling model. We're going to have a little bit of interaction around that as well to keep you guys engaged and get some of your input on that. What must be in place to move forward with assisted hygiene? What are some things that you really must consider if you're looking at integrating that type of hygiene scheduling model? What are some of the best practices for assisted hygiene? And then we'd love for you to share your experience if there is a model that you've used that has worked really well, and also happy to answer questions as best as we can tonight. But we do want to hear from you. We want this to be interactive. And so we'll go ahead and get started. So if we look at our industry over the last 3 years, there's been a lot of, I will say, push-pull. We talked about this when we did our forum on dental hygiene hiring. We talked about this when we did the forum on hygiene compensation back in September. And, here we are again talking about it once again. And there's a lot of areas where we're feeling that. One of the things right now, or that's been happening for a while, but we're hearing still from teams, is that they're feeling that stress point between an increased demand for patient care, but yet a reduced availability of hygiene hours or a reduced availability of hygiene staff, right, to provide that care within the practice. And so, because we're able to work with a lot of practices across the country, because a lot of us are in a lot of dentist forums, practice owner forums, we are hearing what practice owners are doing to alleviate some of those stress points. And I'll share some of those with you tonight. Some of those you'll be like, oh my gosh, that's a great idea. And some you're going to think, no, that's not a fit for me. And that's okay, right? The effort is really just to share, because you never know when something might be a fit and that might work in your practice. And it's just good to be exposed to different ideas. But this is still really happening. We are still talking to clients that are booked out 6 to 8 months with no blocks in their schedule. And then I talked to a potential client today who has availability, tomorrow. So we're starting to see some of the things shift in that regard. But because of these stress points with regards to patient demand, hygiene hours, and also, frankly, increased costs that practice owners are seeing within the business, and decreased reimbursement for those that are in network, that creates stress points that require, innovation in practices as well. So we're just going to share a little bit of that tonight. So for years, I have talked about hygiene open time. And, whether your practice is running and it feels like Grand Central Station, or it feels like a ghost town and you've got tumbleweeds rolling through the hall because there aren't enough patients in the schedule, those are two very different experiences. And there are actually pros and cons to both of those. I would say that the majority of the practices that we're speaking with fall into this Grand Central. Um, let's say, feeling within their hygiene schedule, but I'm seeing that trend change a little bit. I'm starting to see more practices that say, you know what, if we had a patient that was diagnosed with scaling and root planning today, we'd actually be able to get them in within 3 weeks. And to me, that's a really good thing, because it means that some of those practices are starting to see a light at the end of the tunnel, from that patient backlog, and they're starting to be able to kind of pick their head up from, a couple years of really working that Grand Central Station type of schedule, and to see like, hey, we see some light at the end of the tunnel. We have blocks in the schedule that we've reserved for, priority care, and we're able to get our patients scheduled in that. Or we have some open time, and maybe because of the pandemic, or maybe we never really had a clear perio protocol in place, we're ready to do that now. And the good thing is we have room in the schedule to accommodate that growth. So I would still say, though, about 60% of the practices that I'm speaking with on a weekly basis are still somewhere in this Grand Central Station situation, where some of them are booked out a couple months and some of them are booked out, again, still 6 months. So here's the thing is, we want you all to be able to take control of the schedule, not just in hygiene, but also with doctors. And if we don't kind of take a time out, this problem is never going to fix itself, right? So what we see is some teams say, well, we're going to address this at the new year. But then, if we talked about this in the summer and then they don't make a decision to make a change with their schedule or put blocks in the schedule or revisit their systems, if they don't make that decision to take action on that until January, then you're another 6 months right out before you can really start to see a whole lot of light at the end of that tunnel if you're really working in this
Okay, your
model.
hand's hurting you like this.
Yep.
So if
Nope,
everybody
I'm
can
fine.
just
No worries.
please mute yourself. Jennifer, maybe you can mute folks too. That'd be great. Maybe just mute it. Go ahead and mute everybody. Thank you. So that's the one point I would say that I would just really ask you to consider is, at what point are we going to say, hey, enough is enough, time out. Let's really take a little bit of time out, even if it's a half day, right, with your team, and say, what are we going to do about this hygiene schedule and how can we plan for a better tomorrow? And our advice, one piece of advice would be, go and look out in your schedule and see where you can start adding blocks so that you can start um, really serving those patients again with non-surgical therapy. Maybe you have new patients that are coming into hygiene and you want to get back to your, commitment to having room for those patients. What about the patients that need to come in more than twice a year and they've been put out, 6, 8 months? How is that affecting their overall health? Are they maintaining their periodontal health in perio maintenance if they're not able to be seen every 3 months? So take a time out, start somewhere. Even if you can only go out and put one block a day, right? That's better than nothing. And just really make a commitment to reserving some time for that priority care and figuring out if there's a way that you can institute an alternative hygiene scheduling model that might help you address this backlog. Some of the consequences that we're seeing from years of this kind of go, 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 and just filling holes in the schedule instead of scheduling smartly, right? Because it's tough. Our business team has a tough position as well, because they're the ones that are fielding all of these phone calls from patients that are like, what do you mean it's going to be 6 months before I can get? I don't understand. Like, I used to come every 3 months, right? So for them, they see a perio block in the schedule and they're thinking, okay, but Ms. Jones hasn't been in 6 months and she probably has periodontal disease, so let's put her in that block. So it's tough. It's tough from everybody's standpoint. So that's really why it's important to really get all on the same page and figure out what is our solution going to be and how can we work towards that even in a gradual manner. So some of the consequences from this are what we have seen is a drop in periodontal diagnosis and in recommended therapy. And a lot of times that is because of what happens in the hygiene mind. I know because I've been there in the past is okay, so even if I treatment plan this patient for therapy, I can't get them in for 4 months. So I'm just going to do the best I can today, reappoint them for their perio maintenance, and then I'll address it the next time, or reappoint them for their prophy. And then what we see is patients that have been in that cycle for years, and they're not necessarily getting any better. They might not be getting any worse. They're not getting any better, but the hygienists are continually feeling like they're having to do a super prophy every time they see them, right? That creates burnout. It creates, I'm going to say, um, I'm trying to find the right word. It creates burnout, and with burnout sometimes comes a numbness to it, right? So it's like every patient we see is bleeding, so that must be normal, but it's not. So that's another time to take that time out and say, hey, it's time for us to really begin to come up with a solution to address this. Um, a lot of things that we're seeing in hygiene is no time for new patients. So maybe you have a goal for new patients to help the practice grow of 30 new patients a month, but you can only see 15 in hygiene, right? So you're not able to hit those new patient goals. And when new patients have to wait more than 2 to 3 weeks for an appointment, they're likely going to go somewhere else. Um, the other thing that we're seeing is because of a reduction in new patients, sometimes a reduction in just patient flow in general. If you're down one or two hygienists, like some of our clients have been, then that can start to affect the doctor's schedule as well. And if teams start to get burnt out, then the diagnosis tends to not be as thorough, or we're not able to take as much time. So there's a lot of ways that this snowballs. So again, we're just asking, like, now's the time to maybe spend some time with the team. Great time to do this at the end of the year and say, where can we start to take control of our schedule again? And where are some ways that we can really look at resolving some of these things? So we're seeing assisted hygiene as a really strong option for addressing some of that patient backload. Uh, it may not solve the problem completely, but it may give you just a little bit of breathing room. Now, we're going to talk about this in a few minutes, some of these best practices. And so sometimes when we say assisted hygiene, or we like to use the term team hygiene, I did not create that, but I love it. I think it's a great way to term it. Because it is really working as a team with an assistant and a hygienist, or multiple assistants and hygienists. Um, you might immediately feel like, well, gosh, I'm doing as much as I can. And now you're telling me you're going to have me see patients in 2 columns, and I'm going to be seeing more patients. And how is that addressing my problem? So we're going to get to that. We're going to get to that because we have a very clear philosophy on assisted hygiene, and how it can work really well to create that triple win. Um, and again, let's just agree that we're going to keep an open mind as we move forward through some of these things. So we talked about that push pull, and the hygiene profitability point is one of those things that has really come under the microscope over the last couple years. And what I'm going to say is a lot of these, or all of these, the intention of all of these scheduling models is to help you reach that triple win, right, for the patient. So the patients are being well taken care of. They're able to be seen, right, in the time manner that's appropriate for them. The providers have the time that they need to properly care for the patients. And then the practice also wins because we have productive hygiene schedules. So always like to make sure that we address all of those factors in whatever we're recommending. So one of the questions that we have as we move into, when to consider a non-traditional hygiene scheduling model, and I'll define that as something other than just a straight book, right? You're seeing one column, one patient after the other, and seeing all kinds of patients every day. So if we're looking at something that's some alternative to that, one of the things to consider is, do you already have a full house, right? Do you already feel like you're at capacity with your hygiene department? And I'm going to just give a caveat that these numbers are in general terms. There certainly are exceptions to these rules. We have some practices that are using assisted hygiene. And when they're doing that at a very high, very efficient level, they're able to see a few more patients than what's listed here. And we have some that are very they're doing a 2-hour new patient appointment because they're taking, records, and they're doing digital scans, and they're doing sleep screening, and they're really doing a super comprehensive new patient exam and hygiene. So they might see, fewer patients in this, but this is a general rule, is one full-time hygienist that is, and we define that here for these purposes as working 4 days a week, 8 hours a day. Okay, are averaging about 600 to 700 patients in recare. Now, again, if you're seeing a high percentage of your patients in perio maintenance every 3 months, that hygienist may be able to see fewer patients. And then one full-time hygienist plus one hygiene assistant working 2 columns can typically see about 50% more, again, depending on the model. So that's one thing to look out for. And feel free to take a picture of any of these slides here that you'd like to. And then Connie's going to share with us some thought points that we'd love for you to really evaluate your practice on, as you consider whether it's time to incorporate an alternative hygiene scheduling model.
All right, thanks so much, Rachel. Hi, everyone. So what we're going to do a fun little interactive exercise um, to why you may consider using an alternative scheduling model for your office. So I have 7 different phrases that I'm going to read off to you. And I don't know how you want to mark them down. If you have the availability to have pen and paper, pencil and paper, whatever, there's only 7, so you might be able to keep your fingers up. Anyway, some are positive responses and some are negative. So I use thumbs up and thumbs down, but you can use smiley faces, check marks, pluses, minuses, yes, nos, whatever you'd like to. So I'm going to read off these 7 phrases, and I want you to a plus or a minus, depending on how you feel about it. So the first is, we have available appointments to treat all of our recare or maintenance patients at their recommended intervals. Is that a yes or a no? Second would be, there is consistent time blocked for periodontal therapy, gingivitis therapy, and new patients right now in hygiene. So you have those priority blocks in place in your hygiene schedule right now. The third is, the amount of patients that we're currently seeing in the hygiene department is meeting the restorative needs of the practice. Are the patients that are being seen in hygiene supporting what you need them to support in terms of filling up the doctor's chair? The fourth is, we have a solution right now to our patient backlog while we're trying to hire new team members. So you're actively looking for new team members, but right now you have some solutions already in place that are helping you meet some of that patient backlog. The fifth one is, in our area, there is an abundance of hygienists who are just ready to join our team. The sixth one is, the current hygiene schedule supports our practice, a positive practice growth for our office. Like Rachel was saying, if you're wanting 30 new patients a month, is your hygiene schedule right now able to support that? And then the last one is, there are appointments available. If you looked at your schedule right now, there are appointments available for periodontal therapy or maintenance, gingivitis therapy within the next 2 to 3 weeks. All right, so there were 7 statements. So now I want you to do a tally and kind of see where you are. Do you have more positives than negatives, or do you have more negatives than positives? If you had mostly negative, it might be time to consider to use some sort of alternate scheduling model for hygiene. So anyone want to share,
Yeah, I'd love
good
to
or bad?
hear. Yeah, if you
Yeah.
said, hey, we had mostly thumbs up, mostly thumbs down, I'd love to see where everybody's falling in that.
You can say it or you can put it in the chat too. And if you guys ever want to direct message me too, if you want it to be anonymous, then you can absolutely do that and I'll relay the question or comment.
Okay. So as people are sharing those, I know we've got one here. So share away. Let's tell them a little bit. I'll share a little bit about these alternative models. Thank you, Connie. I think those are really great. Those are really great questions to ponder and reflect on as you're thinking about where you need to kind of take a time out with hygiene scheduling and figure out a solution to where you are right now. So for you, I put this example of block scheduling here on the right. And for you, an alternative model might just be block scheduling. It doesn't necessarily have to be something extreme. You may be working in the situation right now where maybe you say, hey, we used to have blocks. And, since the pandemic, we've just been putting patients in wherever we can because they're calling and we just can't keep up with it. And we're just kind of doing the best we can. And maybe it's time to get back to that block scheduling model. Maybe that's something that you've not ever used and you think that would be actually really helpful is to have some blocks on the schedule and everybody committed to those blocks. Um, you know, and that might be an alternative model for you. One of the things that yeah, I agree, Lisa. See, she says block scheduling is a lifesaver because it helps you as a clinician to know that we've got time reserved for the care that our patients need and that we're recommending, right? It's really tough if we are trying to recommend the best care, but we don't have anywhere to put that. And you might say, well, yeah, that's great, but we don't even have any room to put the blocks. Somewhere that you go out, right, into the future, you will have room to put blocks in the schedule. And I would encourage you to go out and put some there. We guide our clients specifically the blocks to add. We give them specific advice on that. And here's what we tell them too is like, look, you might not need as many blocks as we're advising you to add right now, but you can always release the blocks. You can't put blocks in if, 6 months from now the schedule's packed. You're like, gosh, I wish we had put the blocks in, back in November. So that might be an alternative scheduling model for you. Um, Shifts. So we've worked with several clients that have worked in a shift model. So for example, and this kind of goes along with extended hours, is they're open from 7 to 5. So, they have a 5 hour shift, they have a 7 to 1 shift, and they have a 1 to 5 shift. And so or 12 to 5 shift, 7 to 12 and a 12 to 5 shift, sorry. So and then some of the hygienists in this practice would pick up, maybe they work 5 shifts a week. Maybe they work 7 shifts a week. So they could work and they would need to commit to these shifts ahead of time, obviously, but it also created a lot of flexibility because there were some folks on the team that really like coming in early and getting done early because maybe they have a child that gets out of school early and has a lot of activities and they want to be able to support that. And then somebody else has a child that goes to school late, so they can't come in early, or they just like to have their mornings to themselves to run errands and get things done and then come into the office and work into the evening. So that's something to consider as well. And there are ways that you can create shift huddles. So instead of an AM huddle, you might have a shift huddle. And there are a lot of different ways that this can create a lot of flexibility within the team. Extended hours obviously help. And even if it's extended hours for a limited amount of time, right? It maybe if you say, hey guys, for the winter, we're actually going to work, 1 additional hour on Tuesdays and Thursdays. And that's going to help, our backlog, or we're going to block those Tuesdays and Thursday evenings for new patients, or we're going to block those for scaling route planning, whatever that might be. Or, in the winter, we're going to open at 7 because it's a little lighter in the morning. We're going to open at 7 and we're going to have those as, blocks for new patients and scaling route planning, for example. Obviously, assisted or team hygiene is an alternative model where we're working with an assistant and a hygienist in 2 to 3 columns, depending on how fast they want to move with that, and that's totally up to the providers. So we'll go into a little bit more depth with that in just a moment. Utilizing doctors and assistants. So this is one thing that we're seeing practice owners do, and as hygienists, it kind of makes us sad sometimes. But as practice owners, as business owners, we have to come up with solutions. We have to innovate when there's a problem. And particularly when the practice owners are responsible for those patients that aren't able to get in, right? So if you're not able to hire hygienists, what we're seeing is some practices utilizing associate doctors, particularly, to provide dental hygiene services. Sometimes we're seeing them provide dental hygiene services for patients up to a certain age, and maybe the others are being seen in hygiene. That's also happening some with dental assistants, particularly in states where dental assistants can have expanded duties, or even when they, in most states, they can take radiographs, have certification for coronal polishing. And so I think that there is some benefit to assistants having some additional duties that can take some of that weight off of the hygienist so that hygienists can really step in to that role of periodontal therapist. They can expand their work and work at the top of their license while the dental assistants do the same thing and can take some of that load of maybe the pediatric patients off of the hygienist, and the assistants being able to check those, and maybe the doctors come in and do some scaling if that's necessary. So we are seeing that happening as well. We are seeing, obviously, if the doctor's schedule is not packed, them seeing some new patients, but then it also still creates an issue of those new patients are going to want to be seen in hygiene ultimately. So having that time there too. One thing I've seen in the past with a couple practices is having pedo days. So they'll have a pediatric day in the summer, and they'll also have a pediatric day, let's say maybe during the winter break. And you could also do one during spring break or fall break, whatever you feel like would coordinate with, schools in your area being out. And all they do is kids all day long. They bring in, a balloon twister, and they have a bubble machine outside, and they give away prizes, and they make it super fun. And this is great for a family practice that has a lot of pediatric patients. And it's all hands on deck. And the hygienists are typically seeing, working out of multiple columns, or they're seeing patients in less time working with an assistant. And doctors are also doing same day treatment, or they're doing pre-scheduled treatment with pediatric patients as well, and just really trying to make it a fun, unique experience for those patients. And that tends to clear out, right, some of those 30-minute blocks throughout the schedule the rest of the year. And then obviously using guest or fill-in hygienists is always a solution. And I will tell you that there are the largest number of, I'm going to say, staffing, um, let's call it like short-term staffing solutions now than I've ever seen before. And there are some that are really, really great that aren't necessarily fully staffed in all markets, but some that are really doing things in a legitimate way with regards to, making sure that the hygienist is working in a legal manner in every state, that the hygienists are getting paid rapidly, that there's an opportunity for the hygienist and the practice to give feedback and to be able to in these markets place team members in practices. And we actually have a guest hygiene guide that we're happy to have you guys go to our website. You'll see a resources tab, and if you hit the little drop down arrow on that, you'll see a ton of free resources there, and one of them is the guest hygiene guide. Is how can you prepare your practice and really communicate really well with that guest hygienist, so it's a great experience for everybody. So these are just some of the alternative scheduling models. I'm curious if anybody has others that you'd like to share. Jennifer and Connie, if there's anything that you want to jump in on here too, please feel free to do that, or any of our coaches or anybody that's on the call, if you've got anything you want to drop in the chat or you'd like to share, you can raise your hand and Jennifer can unmute you and you can share. Any other alternative models that have worked well for you?
Rachel, I am putting that the website if they want the guest hygienist guide in the chat so everyone can.
You're putting the link there. Perfect. Thank you so much for that. Okay.
Absolutely.
Awesome. Okay. So I would say anytime we're looking at any type of innovation, um, refinement of our protocols, calibration of the team, continuing education and up leveling our skills, skill development, a growth mindset is critical. And I would say Connie would agree that this honestly is the most important piece of, what you want to consider and have in place to start implementing an alternative hygiene scheduling model is that the whole team really has to be on board and ready for this. And it doesn't mean that the team won't have any hesitation, or they might not. It doesn't mean that they're never going to be nervous about things. That's normal, right? Anytime we're doing something different, it's normal to be a little bit nervous about it. And we would hope that you would have a safe environment for your team that they can express that and say, I'm ready to do this. I'm a little bit nervous, so just like bear with me here. It's okay. Like, what are you nervous about? Let's talk through it, right? And we've got your back. So that's normal. We experience that a lot, honestly, when we have clients start to work with Inspired Hygiene and their hygienist may or may not have been part of that decision. We make sure that we have time that they get to meet with a coach to share what are they excited about with this opportunity and what might they be a little bit nervous about, because it's important to be able to get that off their chest. So the same is true when you're implementing different things into your practice with your team. So the growth mindset really is demonstrated when we can we can at least keep our minds open to, that if we make mistakes or we have a situation where maybe appointment didn't go quite as smoothly as we would hope, that it's an opportunity to grow from that and to get better, right? Um, we feel like when you have that culture in your practice of continual learning and growth, it really makes a lot of innovation and changes in the practice a lot easier because the team expects it, right? They expect practice owners that are going to CE that are continually challenging their skills and the things that they learned in school. We all we can't not lead by example, right? So practice owners, doctors, when you're doing that, it sets a really great example for your team. Feedback helps me reach my potential. We had an Inspired Hygiene team meeting today, and we talked a lot about that we're all open to coaching from each other. And that challenges are, again, an opportunity to learn. This is an opportunity to grow our skills and to really experience something that could bring a lot to our patients and to our practice. And that the amount of effort and my attitude in that effort really determines the abilities that I'm able to develop and also the outcomes, right? Because a lot of times, if I go into something with a really great attitude, chances are I'm going to have a better outcome than if I went into it with like a sulking attitude. And that trying something new is exciting. Dentistry sometimes can get, especially for hygiene, can get a little repetitive. So when we have something new, it's an opportunity to kind of get re-energized and get excited about it. And we just also really encourage you, as you're considering some of these things, to incorporate in your practice to make sure that you're being methodical about it. I think we're going to get to that, Connie, right? And some of the things to consider and best practices as you're going through that. So I'm gonna let you take it over.
So
All right.
before we do that, we had a question come in. And someone had asked, do you ever see hesitation from a doctor if a hygienist wants to do this? And maybe what some things that they could say just to help to facilitate that.
Yeah, Connie, what do you think about that?
So I actually have worked assisted hygiene in a lot of different offices because I've moved a lot because of my husband's job. But my current practice, this is the situation I'm dealing with right now. So um, my boss just really, she was very, very, very nervous that our patients were going to see a big difference and that everyone would be overworked and stressed. And there are 4 hygienists there, and I brought up all of the positive points and I said, can we just try it? Can we try it for 2 weeks? And let's just see how it works with myself and an experienced hygienist. And I said, then let's talk about it again and let's see what our ups and downs were and where we had some pitfalls. And I think that she had to really see it in action for it to work. And then she could also see what were the benefits, right? How many more patients was I able to see during that 2 weeks with a skilled assistant? Um, and I was still able to take great care of those patients, and it worked. So I would have just a frank conversation with the provider and just ask them what are the reasons why they don't want to do it. And then some of the stuff we're going to outline today, we've already talked about, are some reasons why you could maybe just try it. try it and give it a try and see if it works for your office and see if they're okay with it. Anything else, Rachel?
Yeah, I would say when you do that, and I'm sure you did this, Connie, is like present the plan, right? What is the plan? We're going to see this many additional patients, and I'm going to work with Jennifer, right, who's going to be the assistant working with me. We already have our communication set of how we're going to kind of hand off information to you, doctor, right? Because part of their fear might be, am I going to get all the information and am I going to make the right diagnosis, or am I going to miss something and then it's going to make me look bad? So I would say, share with them what your plan is, and then they'll see, okay, like they do have this plan mapped out. This isn't just like a seat of the pants thing that we're going to be doing. All right, so I see a couple other questions here,
Mhm.
and um, Dr. Brown said, how many operatories are required for this to operate smoothly with provider schedule and hygiene? I mean, Connie, I would say at a minimum, two operatories, right? That the hygiene assistant are working in. Yes. Okay.
More, right,
Um,
more is better, but
yeah.
you could successfully work an assisted hygiene out of two operatories.
Yep. And I've seen it happen with one hygienist, two assistants, and three operatories. I'm going to tell you that I don't necessarily. That's not for everybody. How about that? That's a whole different level, but it can be done. I don't want to say, there's few things that should never be attempted, but as long as the patients are getting the same amount of care, same level of care, and we think the same amount of time, then, if you have a way to work that out, then I think it can. But that would be the minimum, I would say. And then there's another question. Um, yeah, I see Trish answered Amelia's question. I love that when we answer questions in the chat. What my RDH does not want to do the team hygiene. She said assisted hygiene will be too hard on her body. They frequently call out sick, and I'm tired of all the fluff. They're overpaid, and I'm bleeding. Oh gosh. So, some frustration there. And I would say go back and Trish gave some feedback on that. Maybe go back. And if you email us at clients@inspiredhygiene.com, we can send you the link to the, in fact, can we just go ahead in the email we send out with this recording, Jennifer? Can we just send out the recording for the last
Yep, we can
Compensation.
absolutely
snowstorm
do
as
that.
well? Because that was a really hot topic if you weren't on that one. It was all about hygiene compensation. So that
Mhm.
is one way. But Connie, would you have any insight on how you might address that with the hygienists that feel like it's too difficult?
Well, I mean, we're going to get to some of that. I think that probably I'm going to talk about the definition of it right now, and that might clear up some of that. Um, so we
Yeah.
at Inspired Hygiene, we have a philosophy about assisted hygiene that sometimes meets what offices want to do or are doing, and sometimes it doesn't. We feel that it's the most sustainable model for assisted hygiene to work. So this is a quote. It is care provided by a team that is working together to create a practice which is focused on patient benefits while working smarter, not harder. So there's a lot of working pieces uh, to that definition. And the biggest point that I want to take apart on that is team, right? So Rachel talked about the importance of a growth mindset in the team aspect, right? It has to be teamwork. Absolutely. Assisted hygiene does not work without teamwork. Um, a practice focused on patient benefits. Patient benefits for me is the best part of this model because my patients are being so well cared for when this model is successfully utilized. And then we're working smarter, not harder. So now I have a teammate, I have my assistant who I have helped train, who is me when I'm not in the operatory. So maybe I don't have to do, when we look at the whole list, and it's one of the documents we're going to be sharing with you, is a list. We tried to get a full list of all of the duties that we think about go on in a hygiene appointment. when I take that burden on myself, oh, sometimes I'm like, okay, so what aren't I going to be able to do during this time because I can't get all of that done? Well, now I don't have to get all of that done because now I can delegate my assistant to help me with some of those things that I just wasn't going to have time to do. And I've
Yeah,
expanded my
exactly.
service mix because now I have the opportunity to be doing periodontal therapy while she is starting some child prophies or doing some adjunctive, taking some impressions. Um, for me, when I work assisted hygiene, I'm using my skill set to my highest level, and my assistant is doing the same. And when we can find a good marriage for that, it really, really works. So this is what our definition of assisted hygiene is. So now we're going to talk about what it isn't. And really the key is working harder, not smarter, not harder. So it is not designed to double the number of patients or to increase the speed of the appointment. So have I worked? Absolutely. I've worked as a temp hygienist, guest hygienist. I've gone into offices and they work assisted hygiene on that back-to-back staggered every 30 minutes. I have a patient, regardless of what it is, if it's a new patient or it's period scaling. And that to me is what is very overwhelming. Did I do it? I absolutely did it. Did I get burnt out? I absolutely got burnt out on it. So that is not our definition of what assisted hygiene is. Um, and when we say assisted hygiene, a lot of times with our clients, what our teams say is accelerated hygiene, meaning everything's moving faster, right? We're thrusted into high gear. Everything's being done faster. We're trying to cram in more patients and we just have to go, go, go. Usually when we speed up things, our quality of care is decreasing at the same time. And that's not what we want for our patients. That's not the goal. Any of our practice philosophies is not for our patients to see this difference. So I also want to say, though, that if you're already working a model that is much more than what we're talking about, our ideal, and it's working for you, then kudos. You have figured out the dance and it's working. However, what we find is that there are several things that need to take place in order for a model to work well. The first is, I already talked about sustainability. Um, you can go back one, Rachel. Sorry. Sustainability. So is this model that you have implemented something that this hygiene team is going to be able to sustain for a long term? The second thing is it transferable. So can another hygiene team, maybe you have another hygienist that wants to work assisted hygiene, can they come in and use this same model? Can they duplicate the model that you've created, that we've placed these blocks? Is it transferable to someone else? Speaking of that, is it attractive? So how many of us are looking for additional team members right now? If you have an assisted hygiene model that is that back to back with no blocks and there's no holes anywhere for some breathing room and for some flexibility, how attractive, we have to look at that, right? If we have a guest hygienist in that maybe is coming in just to work for us for a few days to see if our practice works for them, is it going to be attractive to them to want to join our team? So I think attractability, we really have to really see, is it going to be attractive to prospective new employees? All of this has to take place that we're still meeting our standards of care, our practice philosophy, and benefit profitability. So it is a dance. You're going to hear me say that word. It's a dance that has to be learned. You can go to the next slide, Rachel. All right, so Rachel had mentioned earlier that there are some things. So if you are thinking about implementing an assisted hygiene model of care, there's some things that you have to consider before you ever start just throwing your team into it. So do you have the physical space? And we talked about this, both operatory wise. In our office, I'll tell you what we ran into is we brought on a new provider, a new dental provider. So with that came his team, came an additional front team member, and then I instituted assisted hygiene, and all of a sudden we're out of parking spots, right? So do you have adequate parking to sustain for long-term additional influx of more patients at one time, in addition to the operatories we already discussed? Um, are you willing to provide a dedicated full-time assistant for each hygienist? I've also been in offices that are like, yeah, you have an assistant. And then I start and it's the assistant only when the doctor didn't need them. They always got pulled from me. And that absolutely will not work with an assisted hygiene schedule. It just doesn't. Now, are there times when I am fully in patient care, maybe during periodontal therapy, maybe the last hour of a new patient appointment when I don't need my assistant and she is providing adjunctive care? She is helping with emergency patients. That's all stuff that we have identified in the morning during our huddle as that these would be ideal places for those things to happen. But they are dedicated to me first and then the rest of the office afterwards. Are you able and willing to provide the additional equipment, instruments, piezo, ultrasonics, whatever we're using to treat more patients, as well as all of our disposable items, right? It's going to be an increase in having the availability to have everything in line for this additional team member who is seeing now additional patients in the hygiene schedule. Do you have the appropriate admin power to support an increase? Because, right, they have more people checking in, more people checking out. They're confirming appointments now. They have more patients calling. So do we have the correct number of front team members to support an increase in patients? Can the dentist physically see, do they have time to physically see additional exams each hour, right? We have to look at that. Are they going to be blocked for 3 hours for a long procedure that they can't get away from? And now we have 4 or 5 patients that need to be checked. So all of that needs to be taken into consideration. And then the last one is huge. Is your team on board? Have you had the discussions with your team about what sort of change in the schedule or model that you want to do? And has it been an open discussion about how it's going to affect every single team member, not just the assistant and the hygienist and the dentist? Every single team member is going to be affected. So I think it's super important that we have that. Rachel, Jennifer, do you have anything else?
I do have some questions in here, Connie.
Okay.
One is, do you recommend seeing new patients with assisted hygiene or only established patients for recare visits?
In my models that I have worked personally, I've seen every patient mix. So we did see new patients during that time, but also we've looked at the schedule to see at what part of that appointment am I going to need my assistant to. Maybe they're seeing the patient for the first 20 minutes. Maybe they're reviewing medical history, taking all of the radiographs and scans, intraoral photos. All of that is done for me when I walk into the room. I can utilize my assistant to do the existing charting if they haven't had time for that. And then I do the periodontal assessment with their help. And then I move on usually to the appointment on my own. So it's learning how to use your assistant to the best. And all of this is governed by our state practice acts, right?
Yeah.
If you have a brand new green assistant that's never been in dentistry before, we're not going to walk into a model where they're going to be taking radiographs and scans and intraoral photos, and that comes with training. So we're going to talk about levels of assisted hygiene here in just a few minutes. So in the models that I have worked, I absolutely. Now, have I seen models where the dentist has seen the new patients initially and then they got brought back into the hygiene schedule? Absolutely. So it's really where your office is and what your practice needs are at the time as to what blocks you're going to be able to allocate for. Really has to do with capacity. How many patients do you need to see and how many available appointments do you have to meet those needs?
So I would say the most common um, point where I see things break down is the dedicated hygiene assistant, is other people pulling that assistant from the hygiene. So then what happens is the hygienist doesn't know if they're going to be there or not. And so he or she just continues doing, the different parts of the visit instead of being able to rely on them and know, hey, they're right there. Or that assistant, the best time is the assistant shows up before the hygienist actually needs them and says, okay, I'm ready to do the next step. So it doesn't mean that we're not all part of a team, and that, if the hygiene assistant has some additional time, it's perfect for he or she to go in and, help catch up with sterilization or seat a patient, that kind of thing. I think it's really, really important for the team and the leader of the team to communicate super clearly that this assistant's primary role is to help the hygienist care for those patients that are in those two columns. The other thing I would say about new patients is it's great for them to get introduced to this concept right away when they enter your practice. So then it's not unusual when they come back for recare.
Mhm.
Okay, Connie, I know you are going to kind of talk a little bit about the different levels.
Yeah, I mean, this is a pretty basic breakdown. Um, I just really have divided them up into three different levels, right? The basic would be maybe a green assistant that's never been in dentistry before. We're going to train them to start as a steri tech, do some room turnover. They're learning our systems and processes. They're helping us with charting. They're doing tray setups, stocking our rooms, all of that important stuff. So that to me would be brand new, has never been a dental assistant before. A lot of times we find kind of the intermediate level is kind of where we get our hygiene assistants. So they have had some familiarity with communicating directly with patients, but they're not at the level where they can handle solo care. So that's going to be, again, training. I'm going to train my assistant to be me when I'm not in the room. But now we're training them to do medical history reviews. They are helping with our periodontal charting. And sometimes my assistant will actually prep that patient prior to me even coming in about what's going to take place during, my initial perio assessment. They're seating patients, they're dismissing patients, they're recording vitals, they're looking at their medical histories. They're alerting me if they see something on their medical history that I need to be aware of before I step into that room. Taking radiographs in that intermediate level, if that's permitted in your state. That's a huge help off of the hygiene burden, is to have those radiographs done when you walk into the room. Scheduling recare appointments, scheduling restorative appointments, and then doing the handoff to the doctor. We're going to talk about handoffs, the importance of handoffs from myself to the doctor to the doctor. So all of those handoffs, this intermediate level assistant can start helping with. And then advanced is everything up until that point, including and then everything else, right? So my advanced hygiene assistant is doing initial plaque removal. If I'm finishing up scaling on a patient, she has already done everything else, and she does the initial plaque removal. She does the initial polishing, stain and plaque removal. She goes over hands-on oral hygiene instructions because she's learned from me what I'm going to be talking to them about. Like Rachel talked about, sometimes that pedo column is ran where they're seeing the pediatric patients, and if that patient needs scaling, either I hop in or my boss says, hey, I'll go ahead, and they just need some lower interiors, I'll do that, you go ahead with your patient. So again, it's all about teamwork, it's all about communication. But finding that mid-level that you can work into an advanced level is really where we see really, really good success with an assisted hygiene model.
Yeah, and I would also say, Connie, you work at a very high level with regards to diagnostics and care. So Connie
Absolutely.
is working with her team to do a very high level of hygiene diagnostics with regards to oral cancer screenings, medical history review, sleep screenings, periodontal screenings, all of those things, and in part because you have that extra support that you
Right.
can, communicate that, and that your assistant becomes you really are an extension of each other.
Yeah.
So that's kind of how I have felt when I've worked
Mhm.
with an assisted hygiene in the past. All right, so share with us a few best practices, Connie,
All right.
things to
Some
keep an
best
eye out for.
practices. We already talked about having a
Yep.
dedicated assistant, right? Um, as this is an advance, this is a schedule of maybe an early on, just starting in assisted hygiene. This is like a morning from 8 to lunchtime. And you can see this second column, we're adding a few more patients, one extra recare patient there in the morning, a recare child, and then there's an emergency, a slot for emergency, where I'm getting ready to start scaling and route planning, but my assistant has already finished up and they're able to see an emergency patient. So this would be what I would consider just like a transition. Uh, we coach, we have a lot of different templates that we help our clients with, and that's one of the options that we have when we do in-office coaching, is we help them set up these templates as well. We recommend that during the huddle, we have to pre-plan the day. We can look at my schedule and I can say, okay, I'm going to start here, and then you're going to take over here, and then you're going to do this for this patient. And this isn't a perfect world, right? It's not always a perfect world, and we adjust as we need to. But we've kind of already have our dance steps in place, and we try to stick to that the best we can so we have a smoother day. Identifying those shared duties. What is it that my assistant feels comfortable doing? What is it that I feel comfortable delegating? And when you both meet those maximum potentials, that's when assisted hygiene can really be beneficial for everyone involved. The high touch service that Rachel had mentioned, like on those new patients, we have some clients that are seeing a 2-hour new patient and they're doing all of the scans. They're doing a CBCT, they're doing sleep screening, they're doing everything at that initial appointment. And we're maximizing what is my assistant able to do for that patient before I ever come in or after I'm finished. What are we able to continue so that we meet our practice goals for that high touch service for that patient? Maintaining proper appointment time, right? So when we look at how we are, so if my patient, my assistant is in there the first 20 to 25 minutes, I come in at about that 25 to 30-minute mark. I have my 20 minutes of scaling time with that patient because they've already had plaque removal. I have 20 minutes of scaling time. I've already called for my boss to come in to do an exam because my assessment is done the minute I walk in. I scale and then she knows that we're ready and then I can move on to my next patient. So learning that dance of having those correct handoffs and what's the important information going forward to the next provider. What do I want to make sure my assistant is telling the dentist? What does the dentist want to make sure that I got? So we use a communication form. A lot of offices use a piece of paper. It looks like a routing slip. And so my assistant will write down notes, medical history issues, patient issues. I'll put my notes in that I want to make sure that they take forward to the doctor. And then my assistant will also make notes on that same slip about what happened during that exam that I wasn't present for. So I can go back and add to my notes because that slip goes to the front team to schedule necessary appointments if we haven't done that. And that slip comes back to me so that I can then catch up with my notes on anything that may have happened when I physically wasn't in the room.
Yeah,
Anyone else?
yeah, thank you, Connie. That's awesome. And I'll add one thing to note is one of the things that I know that some hygienists fear with this is all I'm going to be doing is scaling, and that's why it's going to be really hard on my body. So number one, right, we want to make sure that we're using current tools for scaling, and we're not feeling like we have to hand scale everything. So we're utilizing ultrasonics as our primary scaling tool. That's what we recommend, whether you're working assisted hygiene or a straight column. Okay, because it's a lot easier on your body and it's just as effective as, I mean, there's been multiple clinical studies showing the results are the same. And then the other thing is, if we look at, let's say, this recall patient here at 10:50, if I'm the hygienist, I'm likely going to see that patient all the way through. I might be able to see this patient all the way through, or I might be able to take a break right here and have the assistant get that patient started. I may see this new patient all the way through, and the dental assistant might get this patient started. So it doesn't mean I'm going to be missing out on the visiting. It doesn't mean I'm going to be missing out on the patient education if that's what I love. It doesn't mean I'm going to always be missing out on the handoff. Like, it's going to be different each day and with your block, your scheduling and how you're scheduling this. And there are going to be times when we're doing all of that, right? Where we have the time to scan on the new patient and have those conversations. So I think that's really important to know as well. And I think a lot of times when, we fear the unknown. If we don't know what it's going to be like, it's different than what we have now, and so it seems a little scary. So I think sometimes that is the where a lot of hygienists have hesitation, is they just assume, or they've heard a horror story from another hygienist colleague about it, but it's like, let's just look at what this could be. And when very often when they see, hey, this is something that's going to start slow, and they might stay at this level for a month, right? They might stay at this level for quite some time to really get that flow. And then they might add another patient here. And they might have one, they might add one patient in the morning, and they may not add any additional patients in the afternoon. And it might end up being, just 50% more new patients, but I'm sorry, 50% more patients than they would see in a straight column. But think about the impact that that could make as far as patients getting the care that they need and being able to put some blocks in there too. So thank you for that.
Yeah, I
That
think
was great,
Rachel,
Connie.
real quick before we jump on, Rachel, you and I got a question recently. If assisted hygiene or team hygiene could be used in a, we'll say, very high end practice, right?
Yes.
And the answer to that was absolutely yes. And it's assisted or team hygiene is not meant to be, to expedite things like Connie was saying, or to make it like, we'll say like a mill, right? That's not the point.
Yeah.
You can deliver extraordinary patient care and have even more of
Yeah.
that high touch environment for a very high end. The term that was asked was bougie.
Bougie.
Consider
Yeah,
Yeah.
this in a
Does this
bougie
bougie.
work in a bougie
practice.
practice? Yeah, it
Absolutely.
does. Yeah.
So,
Just
and it works great. And it actually um, gives you even better patient reviews. Your patients have more time and more experience with other team members and can help to build that relationship
yeah.
even more. So,
Yeah.
yeah, just wanted to make sure I mentioned that too.
Thank you. Yeah, thank you for that.
It's
Yeah,
funny,
because
Jen, that you should, sorry, Rachel, go ahead.
that's okay. Go ahead.
You should mention that because many times in our patient reviews, when they mention, okay, so Carla, I met Carla, who was an amazing assistant, and then Connie, and then the doctor, and it felt like a spa experience. And patients have actually said it was so bougie. I didn't even know that I was at the dental office, right? From the music to
Yeah.
the color of the walls to everything, the scent, everything is
Yeah.
very, very, and so we consider our practice a spa-like experience. And these patients are still giving us amazing reviews that I
Mhm.
got care like I have never, ever, ever experienced before in a dental office. And we take each of those reviews to heart. We answer each one of them individually. And it's just an amazing feeling that we are providing top-notch care
Mhm.
and this patient is being seen by 3 different providers during that visit.
You
So
can still do the
and
warm towels and all of that stuff.
Right.
yeah,
Yeah,
we do all
Right.
that
And
bougie stuff.
and
absolutely.
now instead of me like, rushing between patients to get the warm towels, I have some support with that. Or maybe the assistant is seeing the patient. I'm getting the warm towel. Like we're working as a team together.
Yep.
So I know we've covered some of this, Connie, but are there
Yep.
any of these that you want to just really drive home before we wrap up?
Um, so I think probably the 2 biggest ones for me are a clear handoff process. So we call them scripts. We have scripting. We have scripts made up for, and when people say scripts, it's not like we deliver them like a robot, but we practice them as a team. We have dedicated practice times, especially if we bring on a new
Yeah.
team member. We do a lot of shadowing in our office for the university, so they come and shadow us. We practice what these scripts sound like, what those handoffs sound like. But foremost, what does my employer, what does the dentist need to know from me via my assistant? And the same thing, right? So it is that form of communication, practicing those handoffs. The second thing, most important, is your clear standards of care. If you
Mhm.
do not have
Agree.
a written standard of care document, that's one thing that we do for all of our clients is we help them establish their own version of a standard of care document. So as a guest hygienist, anytime that I walk into an office and if I was handed this document that said, here's how often we take bite wings, this is when we take vertical bite wings, this is how often we take panorexes, here's our diagnostic outline for the patient has 4 to 5 millimeter and they have bone loss. Here's what we would do for this patient. Here's our recommended our treatment. Um, that to me is just like the best possible thing. And again, to transferability, when you have a written standard of care that every single team member has had an opportunity to put input and it's a team experience, everyone knows what's expected. That makes my job easy. I know exactly when this, and this is going to happen, and it really makes things a lot easier. So those are the two
Mm-hmm.
biggest things for me, is practicing handoffs and make sure that you have a standard of
Mm-hmm.
care in place.
Got a
Um,
really good question in here, guys.
okay.
How do you verbally introduce this team hygiene concept to existing patients, as this will feel a little bit different than what they've experienced in the past with their hygiene visits? So do we have any verbiage that we can share to help with that?
So we're very upfront with our patients, and we'll just tell them. My assistant, when she goes out to get them, because the very first thing when we made the transition was, "Where's Connie?" Like I made my appointment with Connie, and they'll say, "Absolutely. I'm Carla. I am Connie's dental assistant. I'm going to be taking care of I'm going to be taking care of you today partially. Connie is going to be coming in very soon to see you." Um, and it's just a way that we have, how does she say it? She says, I'm trying to think of the exact words that she uses. She doesn't say anything about she's seen someone else. That never ever
Yeah,
comes into
right.
play. Never ever will she come in and say to me when I'm with the patient, "Hey, your next patient's ready." None of that happens verbally. She may slide me a piece of paper, but being very careful with what our words are, because the patient is always listening. But she's just very clear that I'm going to be getting you started today, and then Connie's going to be coming in, and then the dentist, and then the doctor's going to be coming in at some point during the appointment. We never say at the end, because once my hygiene assessment is done, I turn that appointment a color where my
Mhm.
boss knows if it's a good time for her, please come in at any time during that appointment so that we can get her exam done in a timely manner as well. Any other, Rachel, how would you say in terms of a script for introduction?
Yeah, I think that's great, Connie. And what I've experienced is just handling the objection, before it becomes an objection. So just what you were saying is your assistant coming out and saying, "Hey, Ms. Jones, I'm Rachel, and the great thing is that I'm working with Connie today, and you're going to get to work with both of us, and I'm super excited to help take care of you. And I'm going to go ahead and take you back, and then Connie's going to come in shortly, and then." And then we get to have that handoff, you know um, and hopefully ideally have some type of verbal in-person handoff if possible. There may be times, right, where you don't get to do that, but you can tell Ms. Jones, Connie's gonna be in just a moment, and I've documented everything that we've talked about here so that she knows exactly where we are, and you won't have to repeat things, and she's just going to pop back in just a moment. So like letting them know before they question it, what's happening at the next step, I think is great. So
Our goal in our office is never to be left alone. The patient is not
yeah.
sitting in the operatory wondering what's going to happen next, because we've already had that discussion about what the next step is. They already know that they're expecting me. They already know what's going on. So they're not sitting there wondering, okay, well, they did this. Like, when am I going to? They already
Yeah.
know. We've already
Yeah.
used all of
I
our.
love it. They know what's going to happen next. So I want to give everybody just a little insight too, is that Connie and I are developing right now a team hygiene online boot camp. So some of you have been a part, whether you're a client or you've been able to engage with the Perio Protocol online boot camp in the past. We're building something similar for team hygiene. It's going to be available in the first quarter of 2024. So just keep an eye out for that. You'll get emails, you'll see it on social. Make sure you're following us, and we'll let you know when that's available and ready. But we are going to be doing that. So there'll be, you know, um, lots of detail that we can provide for you guys so that you can begin to implement this in your practice. And anytime we are trying to create those sustained hygiene results, right, involves that training, then we implement what we learn, have support, right? So be there to support the hygiene team as they're moving through this new way of scheduling, a new way of working and serving patients. And that helps them develop that confidence, which yields results, and then it just starts all over again. So I just want to say that we always want to make sure there's a triple win in there, for our patients, our providers, and our practice. And patient outcomes have a great way of driving business outcomes. So if we take care of our patients, then we're going to see the results that we're looking for, within our practice. And we just always love to work with teams like this one that are open to growing, that have that growth mindset. We're always happy to, have a conversation with you if you want to chat about, how we can help support you all in implementing this, in calibrating your team, and really elevating the services and systems within the hygiene department. We're always happy to do that. You can scan this. You can reach out to us at clients@Inspired Hygiene. You can go to our website and you'll see a little link that says book a discovery meeting. Would love to, I'll be chatting with you personally. So would love to do that for you. And then always, we love to have you join us, on the January Growth Forum. We're going to be talking about expanding hygiene services. So what are some new emerging products that you're going to want to know about for your practice? There are going to be some new codes coming out, next year, and just want to be able to share that with you so you guys have a really great year of elevating your service for your patients and then seeing those great outcomes for your business too. So thank you so much. I know I thought I saw another question about radiographs, and my answer for that is going to be, that's going to vary, right, from practice to practice. But I would say typically it is, if we can do some type of panoramic or CBT plus bite wings or an FMX, that's always ideal, so we get a good, glimpse of everything. Were there any other remaining questions, Jennifer?
No, I think we hit them all.
Awesome. Thank you, everyone. We really look forward to you joining us in January. Thank you so much for being here with us. Thank you, Connie, and thank you, Jennifer. And thank you to the Inspired Hygiene coaches as well for being on. Really appreciate you all.